Hello and good afternoon, everyone. Welcome to our Alzheimer's Family Support Group webinar. If you are watching us from home or wherever you're watching us from, please feel free to let us know in the chat box. So if you're new to Zoom, there is a option towards the bottom of the screen, and you are able to note in where you are watching us from. Let us know your name if you want to do that as well. We're curious to know. So my name is Bianca Gonzalez. I'm actually the Bullying Prevention Program Coordinator with the Riverside Medical Clinic Charitable Foundation. And first off, I just want to go ahead and thank our wonderful sponsor, the Riverside Medical Clinic. We truly appreciate your support. And there's going to be a short Q&A towards the end of the webinar. So if you have any questions, please feel free to save that until the end. If you do add in any questions in the chat box during the webinar, we will make sure to go over those towards the end for you. So with that being said, I want to go ahead and get into introducing our presenter for today. His name is Dwayne Wright, and he oversees Pearl's education and outreach for the Inland Caregiver Resource Center. A little bit about the Pearl's program at the Inland Caregiver Resource Center is that it's used nationwide. Pearls is an evidence-based approach center, or an evidence-based approach created to reduce depressive symptoms and improve the quality of life for seniors. Pearls enables older adults to create long-term changes that can allow them to have a more active and rewarding life. In this presentation, Dwayne is going to talk about how sleep patterns may change with age, sleep-wake cycles, chemicals and hormone changes, health conditions that may affect or be affected by lack of sleep, sleep disorders, and some tips to have a better night's sleep. He will touch on some negative effects of poor sleep, such as depression, and resources available in the community. So I want to go ahead and now give it away to Mr. Dwayne Wright.
Hello, everybody. Thank you for joining us today. Like Bianca said, this is about sleep hygiene. So we're gonna get started. So we're gonna go over sleep in the body, sleep in aging, sleep wake, cycle change, chemical and hormones, health conditions, lifestyle, sleep disorders, sleep tips, not enough sleep, what happens when that happens. And we're gonna go over a little more about pearls. So sleep in the body. Regardless of age, a good night's sleep helps improve concentration and memory, allows the body to repair damaged cells, and refresh the immune system. Sleep in aging, the most healthy older adults, 65 plus, need 7 to 9 hours of sleep each night. As people age, sleep patterns may change. However, disturbed sleep, waking up tired, and other symptoms of insomnia are not a normal part of aging. Sleep and aging. Some common sleep changes include getting tired early in the evening, waking up early every morning, waking up in the middle of the night, and not being able to go back to sleep, having insomnia. So the wake cycle change is when the sleep-wake cycle can change in older adults due to age, lifestyle, and health conditions. All of those things can actually affect your sleep. This involves changes in time, the time you go to sleep, how many times you wake up during the night, and at what time you wake up in the morning. Chemicals and hormones. As people age, body chemicals change. The body produces less growth hormones and less melatonin. Both help you sleep better and feel rested and refreshed in the morning, while the body repairs itself during the night. So health conditions. Some medicines can affect sleep patterns. Pain can keep you awake. Diabetes and prostate issues can cause sleep disturbances. And with pain, it's like, not being able to be comfortable while you're sleeping and waking up in the middle of the night because of the pain. Conditions like congestive heart failure or kidney disease may cause sleep issues. Not being able to lay flat or get comfortable. Menopause, postmenopause, and hot flashes can also cause sleep issues. So your lifestyle, lack of exercise and not feeling tired at all at night can affect your sleep. stress, significant life changes, retirement grief, or housing problems, lack of social engagement, being less active, lack of sunlight, it regulates melatonin levels. So if you don't spend a lot of time outside or, have your windows open, things like that. Sleep disorders. So sleep apnea is a big one. Breathing abnormally stops and starts while sleeping. Breathing stops for 10 to 30 seconds. People gasp or snort, start breathing, and can wake up in the middle of the night. Can occur hundreds of times in the night and can be harmful to your health. So if you think you have sleep apnea, you should really talk to your physician. Restless leg syndrome, or RLS. Leg pain or discomfort while sitting or laying down. It can feel like legs won't be still. Periodic limb movement disorder, PLMD. You kick your leg while you sleep. Most of the time you don't know you're kicking. Some people have RLS and PLMD. A couple of sleep tips. Limit caffeine, alcohol, sugary foods intake. Avoid big meals and large liquid intake before bedtime. Keep a regular bedtime routine. Don't take naps longer than 20 minutes or later in the day. Use your bedroom for sleep only. Try not to fall asleep on the couch. Don't do anything to stimulate your brain before bedtime. Watching too much TV, being on a cell phone, things like that. Try to be active each day. Don't stress over the fact that you can't get back to sleep. Make relaxation your goal, not sleep. Reduce mental stress. Postpone worrying. Try relaxing techniques. Talk to your doctor. You see on the bottom right here, meditating is a really good way to relax. Reading a book, things like that. So not enough sleep. Interrupted or insufficient sleep can lead to blue mood, attention and memory problems, anxiety, excessive daytime sleepiness, increased risk of health problems like cardiovascular disease, diabetes, weight problems, and breast cancer. Sleep changes, difficulty, concentrating, feeling tired or with little energy, having a little interest in pleasure, and doing things can also be seen as symptoms of depression. Oftentimes, as studies show, a blue mood and poor sleep go hand in hand. If these symptoms are ignored, they can become more persistent, unmanageable, and more difficult to cope with. Knowing that there are in-home free senior resources available in your community can make all difference in the world. So PEARLS, the company I work for, stands for Program to Encourage Active and Rewarding Lives for Seniors. PEARLS is a free prevention and early intervention program provided to individuals 60 plus in Riverside County. PEARLS reduces symptoms of depression and increases social, physical, and pleasant events through methods of problem-solving treatment and behavioral activation. Symptoms of depression are often caused by problems in life. PST helps individuals exert control over their problems, increase self-efficacy, and increase hope, and thus lessen symptoms caused by anxiety and depression. Behavior activation. When someone is anxious or depressed, they are often withdrawn from their usual pleasant social or physical activities. Behavioral activation helps individuals reestablish healthy routines, increase positive, expressive experiences, and overcome avoidance patterns. This activation leads to improved mood, and better functioning. PEARLS is free in-home based program that consists of 6 to 8 visits that start out weekly, then bi-weekly, and then monthly. Now, pros has changed a little bit since this pandemic hit. Now we do everything virtually or on the phone. So if you have a computer, we can do a face-to-face on the computer through Zoom, or we can, any other app you want to use that's cleared, or we can actually just go over the phone. It's no problem. But we've been working this way since March. Pros requires full client participation. Pros begins as in-home screening to determine if Pros is good fit for the client needs. And again, it's not in home. We do the screens on the phone, on the computer. The purpose of Pros is to decrease feelings of sadness, loneliness, lack of interest in doing things, stressed and overwhelmed, or even that feeling of being stuck. All right, so we've gone over the sleep is an important part of life and health, both physically and emotionally. Recognize unhealthy and abnormal sleep patterns and what may be the causes, habits, health conditions, emotions. Use tips to help improve sleep quality. Reach out if you need help and talk to your doctor. Use community resources. And like I said, I work for Pearls. And if you need the contact information, we'll do that too as well. You can see the number over my head. And that's it, Bianca.
Thank you. Do you mind, I would like to add in your contact information in the chat box, but in your background, it's a little bit smaller, so it's a little difficult for me to see, but if you want, you can stop sharing your screen, and if you want to add it in the chat box for our attendees, so that way they at least have your contact information, that'd be very useful for them. And then we are open for questions. So if you have any questions or comments when it comes to getting a better night's rest, I think this is really important, especially during this time. I know that you touched upon, I think this is a big one for some of us, is being like constantly on either our cell phones or watching TV or being on our laptops right before bed. And obviously that is not healthy for us, and it's not going to give us a better night's rest, especially it's not going to help our eyes in any way. But what about like other factors like setting the tone for your room? Like what about temperature? Like should we have more of like a colder temperature in the room, making it more, cozier, or what do you think about that?
Well, I mean, that would make sense. It really depends on the person. So one of the things we also touched on was the being relaxed. So you want to be relaxed. You don't want to be stressed when you're sleeping. A lot of people mess with the thermostat constantly throughout the day, depending on how the temperature is outside. But when you're ready to go to bed, it's important to actually make sure you're comfortable where you're going to sleep at. So the idea is to, the temperature, the thermostat, what temperature it's going to be at night, and you just go ahead and preset it, so that when you're actually tired, you don't have anything to think about. You can just lay in your bed and go straight to sleep.
Thank you. We have a question from Linda, and she would like to know, what can I do to stay asleep? And she noted, I fall asleep just fine.
Okay, so what are the reasoning? Well, I guess the reason that the question would be, why do you wake up? Like, how long do you want to sleep? If it's something that you're constantly having a problem with, you might want to talk to your physician about sleep problems. I'm not a physician. I can't tell you, medications or anything like that. But as far as staying asleep, if you can go to sleep, you might not be as tired as you need to be when you go to sleep. So being more active throughout the day, whether it's mentally or physically, try different things to try to make yourself go to sleep that way. And like Bianca was saying, try not to stimulate your mind prior to going to sleep.
Yes, definitely.
Try different times, maybe an hour prior. Don't watch any TV. Don't read any books. Don't look at your cell phone. Yeah. Good.
Thank you. And then Alina actually noted that you could search on YouTube for bedtime meditations. I think that's a really great and helpful tip. Even if you have a cell phone, you can even, let's say if you listen to a certain app, I know that there's the Calm app, There's so many different apps, and YouTube is super simple. You literally can just search bedtime meditations or maybe nature sounds. You want to listen to the ocean, or if you want to listen, you know, insects out in nature or birds chirping, you can definitely do that to help you fall asleep a little faster as well.
Yeah, I mean, one of the apps I find myself using is Calm. It's on my cell phone. My cell phone sits right next to the bed. You know, I have it preset, and it stays on for like 15 minutes or so. I find myself falling asleep before it's over. Things like that. You know, it's not there's a lot of different apps out there, and there's also tapes you can buy. I guess CDs nowadays, but yeah, there's a lot of things you can actually buy to help yourself sleep.
Yes, definitely. What about like natural medications to help you fall asleep? I know melatonin is one. What are your thoughts on that?
You know, honestly, like I said, I'm not a physician, and I think melatonin being all natural is the best thing that in any situation. But I would start by talking to the physician, you know, and seeing what's. I wouldn't want to put anything out there to somebody that's not able to take something, and then So, but yeah, melatonin is a very good. It's not too strong, and it doesn't knock you out. It just kind of helps you relax.
Definitely. Awesome. If
And
there's
that's the key. That's the key before you go to sleep. Also, just relaxing, that helps you go to sleep a lot faster.
Yes. And then we have a comment from Linda, and she noted essential oils are nice to help you relax.
Yeah, that works. Different smells are relaxing. I find peppermint is a very very good relaxing smell. Not too strong, you know, just oils with scents that you're used to. Um,
Yes.
and I know I said earlier, not reading books, but you know, some books like myself, I get into books and they get me all hyped up and everything. But there are some books that you can read that help you go to sleep as well. So that might be something that you might want to look at.
Yeah, that's a very helpful tip. And when it comes to the essential oils too, I know that lavender, eucalyptus, mint, those are all great ones to help you fall asleep. If you have a diffuser, you literally just put a couple of drops in that and during the night, and it's very, very helpful. Help you fall asleep a little bit faster and just relax you. We have a question from Jennifer, and she would like to know how much is Pearls and do they take her insurance? And she knows that she has insurance through RMC.
Okay, so Pearls is free. It we don't need your insurance. Basically, you call the number that I put on there, the number you see over my head, and we'll talk to you, and we'll see if you're right for the program. And we have a screening process we go through, and we don't require any payment at all. We receive grants, and so we're, you know, you'll just it's just a phone call.
Awesome. So very simple to reach out to you and learn more about your program. That's great. And then we have a comment from Joel, and he added warm milk might help. So what about like what about teas or different types of like foods or drinks that can help you relax a little more?
Yeah. Well, I wouldn't. In the slides, you know, we're talking about foods, not eating anything too big to you know, close to the right before you go to sleep. But you want to avoid drinks, hot drinks that have caffeine in them, obviously, and sometimes you know, warm milk. If you're able to drink milk, yeah, that can put you to sleep. I'm sure that, you know, there are some things that, you know, you can research and you can look out there that might help you sleep a little easier. But yeah, a lot of hot drinks have caffeine in them. Whether it's a little bit or a lot, depending on how much you can take, it might keep you up a little bit longer.
Yes. Awesome. So if there's any more questions, please feel free to leave those in the chat box. This webinar is recorded, so we will go ahead and upload it on our YouTube channel. And you can go ahead and rewatch and get all of this useful information. I will also be sharing this PowerPoint to all of our attendees. And I want to go ahead and just thank our presenter today, Dwayne. Thank you for all of this useful information. I think during this time, like I said, we definitely need some helpful tips to just feel a little more relaxed and rested. So I really appreciate it. And I want to thank everybody for attending today as well. If you have anything, any last words, Dwayne, please feel free.
Thank you for the questions. I know some people out there don't ask when they think about it, so I'm pretty sure the questions helped other people as well. They don't want to speak up at the time.
Yes, definitely. Well, thank you so much. And I hope everyone has a great rest of their afternoon. Thank you, Dwayne.
Thank you.